It's Health Thursday, and this morning we want to focus on Chronic Disease Awareness Day. This is not a day globally recognized yet, but of course other countries are celebrating this day on different months, others in April, others in June, Kenya, July, but we'll be finding out why is ours set for July. And of course, today we are shining the spotlight on the growing burden on chronic illnesses in Kenya. What are they? What's driving the numbers, the increasing numbers of chronic illnesses in the country, and what do we need to shift in regards to our healthcare system, and of course personal lifestyle. Joining me for this conversation is Monica Wanjiru, a general practitioner at Myer Kidney and Health Hospital. Karibu sana, Daktari.
Thank you so much for having me.
Good to have you again. So let's start with the basics. You know, we're talking about chronic illnesses, but usually this is not something that we talk much about. Mm-hmm. What are they, and how different are they from, you know, when you talk about malaria, mm-hmm. homa, say typhoid, how different are they?
So when you talk about chronic disease, it's something that has been there, but generally the burden more was on infectious diseases that you've mentioned, the typhoid, the malaria and all that. Mm-hmm. But we've seen the rise in chronic diseases. Mm-hmm. And just to start with the simple explanation of what chronic disease is, it's something that is persistent for more than 3 months, and there's no cure for it. So we're seeing an increasing burden. Of course, we're going to mention a few things that have caused the rise of the conditions, and then that's why we're putting a lot of emphasis, because we're seeing more increase in turnout in the hospitals, complication and all that, and decreased quality of life because of such conditions. Mm-hmm. Yeah.
So when you talk about you're seeing increasing numbers in hospitals, mm-hmm. and I know the NSDs, that is the non-communicable diseases, mm-hmm. Now cause around 27% of deaths in Kenya, and of course occupy nearly half of hospital beds, like you mentioned. Mm-hmm. So what does this mean for everyday, you know, people seeking healthcare in these mm-hmm. health facilities, and what's driving the rise in these numbers?
So we can start first with what is causing the increase right now, mm-hmm. because we're seeing a change in lifestyle, of course. Mm. Starting with simple things, what you eat is what you are. So mostly diet is what is affecting us. And of course, the increase in urbanization, how you've seen a shift in diet as compared to people in the rural areas. So we're seeing a more increase in the urban setup and like in the rural setup. We have also seen, basically in the rural areas, people are physically active. Either they're in the shamba, they're doing something, actually they're active. But in the urban sector, we're seeing a lot of sedentary lifestyle that is also driving the increase. Mm-hmm. There is also our recreatory behaviors. Mm-hmm. Before we used to go to the field, run, go see a match or something. Mm-hmm. Nowadays people are either going to clubs, having a drinks out there. Smoking is also in the increase, and this mostly it was more gender related, because men were doing more of the recreation drugs. Right now everybody is doing it, even women and even children below the age of 18, which is also affecting our metabolism and causing the increase. There's also environmental hazards, there's industrialization, there's chemicals that are in the air. So those are just among the few basic things that are causing the rise in the burden. So this also has caused an increase in the healthcare system, increasing the burden. And like before, you find most of the people in the outpatient will be coming for simple ailments like respiratory issues, which are the leading cause of most of the acute outpatient cases. Mm-hmm. Nowadays, you're seeing that it has gotten to a point that the hospital is setting aside a segment for chronic care management, mm-hmm. to manage the diseases. And you find, especially if you worked in public sectors, you find there are different days for those clinics. There's, for example, I used to work, there's Monday from MOPC, that is medical. There's surgical, there's all those. So you're seeing that it's a need, there's a need to put more focus on this, mm-hmm. especially on the prevention side, to see how we can be able to calm this down. And the problem is, mm-hmm. chronic disease start as one, and they always find a way to bring others on board. For example, we start with simple hypertension, but we later progress either to kidney issues, heart issues, mostly because of control, follow-ups, and monitoring. Yeah.
So can someone look extremely